A painkiller is a drug or medicine that relieves pain. Vicodin is a combination of acetaminophen and hydrocodone. A painkiller is a drug or medicine that relieves pain. To start, Vicodin is a combination of acetaminophen and hydrocodone. Vicodin causes the brain to stop producing endorphins, which are the brain's chemicals that control pain and feelings of stress or fear. Next, Percocets contain a combination of acetaminophen and oxycodone. Percocets cause a numbing feeling and sometimes cause a high. Codeine attaches to opioids and changes the way a person experiences pain.
Abusing painkillers can often lead to many different harmful side effects on the body. The abuser starts off with less severe effects with low doses of the drug, and as they slowly crave more, the more severe the side effects become. In general, low dose effects can be dizziness, drowsiness, impaired concentration, and slowed breathing. At high doses, painkillers can cause an overdose or other serious problems. Vicodin, Percocet, and codeine all have similar effects, but they each have their own unique characteristics. Some of Vicodin's short-term or low-dose effects are anxiety, euphoria, which is then followed by an unhappy state, and constipation. Long-term or high-dose effects could be seizures, convulsions, nausea, vomiting, or liver damage or failure. Some of Percocet's short-term effects are itchy skin, lightheadedness, depressed feelings, and vomiting. Its long-term effects are confusion, twitching, and feeling annoyed or agitated. Some of the short-term effects for codeine abuse are dizziness, stomach cramps or pain, and headaches. Its long-term effects include an irregular heartbeat, a collapsed portion of a lung, kidney problems, and nervousness or feelings of terror.
Painkiller addiction continues to grow throughout the United States, so there are many actions that can be taken to prevent the addiction from beginning. The individual, for example, should only use as many painkillers that are prescribed by a healthcare provider. Using more than recommended can eventually lead down a road of addiction. Consult your doctor if you want to increase the dosage. Make sure that you are the only one using them. Don't sell or share painkillers. If taking painkillers, put them in a place that is not easily accessible to others. Also, try a combination of different other pain management techniques, such as using heat or stress relief. Healthcare providers can also take small measures to prevent addiction. They should only prescribe pain medication if and when they are needed, and only if the pain is excessive and debilitating. Teaching the patients about safely using, storing, and disposing of prescription painkillers can help a lot.
I played 8 years in the NFL. A lot of injuries, left the game with serious back and neck injuries. When you're in pain, you take the painkillers. And in the beginning, it was normal, about 120 pills a month, but it quickly escalated to 400 to, at my worst, I was taking 800 pills a month. And my tolerance level when I left the NFL was extremely high. So when I did have, problems with my neck and my back, what you would take one Vicodin, I needed 4 Vicodin. And it escalates from there. Oxys, Roxys, Percocets, Vicodin, Somas, muscle relaxers, anything I could get my hands on. I had 3 doctors at the time prescribing medication, but obviously I was going outside of the prescription world. When you get to a certain point where you're taking 800 pills, you're not so much taking it for the pain anymore. Your body needs it to function. And you wake up with the thought of pills on your mind, you go to sleep with pills on your mind, and you will sell yourself to the devil to make sure that you have them. After the show was over, I would go get my truck. I would take 15, whatever I had, right away, because I was afraid the pain was going to catch up to me. Now, if I got stuck in traffic, I took 20 more. This is the life of an addict. You're not even thinking that you're in a vehicle that can kill just about anybody, but you don't think that way. You're so afraid of the pain that the pills are the most important thing.